Alrighty then, video counseling session number 2. I realized that the first session was a little bit dry and formalish. That was my first video, and as with all of these things, the first song of the set kind of sucks. But I think the content was pretty relevant. So let's get going with number 2. Let's cycle back to the first question. How would you like to feel if you could feel any way that you wanted to feel? I realize that it's one of those cheesy-ass substance abuse counselor questions. However, we use these substances in order to feel good, in order to feel different, in order to experience relief. So let's cycle back to the first question, and I want to put a little extra ditty on that. If you could feel any way that you wanted to feel, how would you like to feel? And how did these substances enhance the way that you prefer to feel? Not anybody else, but how do you prefer to feel? Was it a feeling of calmness, a feeling of relief, a feeling of exhilaration, or combinations thereof? The next question tagged onto this would be, how did your use of the substances detract or take away from your ability to feel these things? Let's say that you used alcohol to curb social anxiety. Did you find that your social anxiety increased as a result over the long haul? And that the only time that you felt less anxious is when you were relatively intoxicated? Let's say that you use marijuana to cure boredom or depression and to make just mundane things more interesting. Did you find yourself needing to stay high longer, and feeling even more acutely depressed and or bored when you weren't under the influence? In other words, in what ways did these substances stop working to make you feel the way that you wanted to feel? And lastly, for this little segment, and I know you guys are geeked and pumped, can you feel the healing continuing? I'm sure of it. In what ways did you try to manage the side effects of these substances and fail? So the final question in this part of the series would be regarding all of the prior questions. Did you find yourself not caring about the fact that all of that stuff should have mattered? And do you find yourself responding to these questions in a way that kind of elicits some internal resistance? Do they make you feel uncomfortable in any way? I would invite you to just kind of settle into this and allow it to incubate a little bit, and take your time answering some of these questions. Any sane person doesn't put themselves through these kinds of struggles, but there are some of us that do, because what the substance does for us perceivedly is so damn important. And that's why some of you are probably listening to this with some curiosity. And it's most certainly why I make videos like this, because I care now. And therein lies the transformation that I've undergone, and I would like to share that with you. Take care. Talk to you soon. Look me up, hillsg4@gmail.com, and subscribe to my YouTube page if you would be so kind. Thank you.